Hello, Ajit.
Yes, Roman, welcome. Good evening.
Good evening.
Yeah,
Uh, Tell me, please, you are creating new rubrics. We have
yeah.
so many books in homeopathy. We have so many rubrics. We have to handle with all we have. Why new rubrics, Ajit?
You see, because the situation with the human beings is also changing. Take, for example, the corona outbreak, and it brought at the surface so many new things. This novel coronavirus really is like a Pandora box. Every time you open it, and you have something new. We were knowing cytokine storm, which we studied in physiology and pathology. But cytokine storm could become a main force of death amongst the corona patients, was something which needed a consideration from homeopathic community. Ready-made availability of this cytokine storm as a rubric is a very important contribution for homeopaths who has to handle such cases in a hospital. When in India, government gave us the permission to treat mild and moderate cases, you will wonder we started getting cases even from the hospital. Even many allopathic brethren tried to contact us and tell we cannot do anything now except this oxygen and we have used all our weapons. Do you have something to offer? And then there was a question to me by an allopath. Do you know what is cytokine storm? Do you have remedies against this? I suspect, do you know this? You know, I thought that why I don't know cytokine storm. Then I decided to study deeper from the clinical standpoint, from the pathological standpoint. So I first studied the cytokine storm. Then I made a list of the symptoms which are there, symptoms and signs and pathological changes that occur with cytokine storm, with a lot of investigatory parameters, the cytokines that are released in the system. Then I tried to correlate this with the repultorization. So I made a list of all the rubrics together. Then I made a repultorization of this. Then I had a big vision now how I can treat cytokine storm. Take
Can
for
you show
example,
the rubric, please, Ajit?
I will show you. Are you able to see it? Are
Yeah,
you able
great.
to?
We can see it.
Yeah. You see that the cytokine storm is also called as a macrophage activation syndrome. This is a systemic inflammatory response, and it could be triggered by drugs, it could be triggered by several infections, not only the viral infection of the corona. Now, basically, cytokine storm represents the failure of the inflammatory response to return to homeostasis. So the pathology becomes unregulated, relentless, uncontrolled. And a lot of cytokines are released in the system, in the blood, in the organs, and then they damage. This is the thing with all this. And then we have the so-called ARDS, acute respiratory distress syndrome, which we call as a hypoxia. So now, what are the rubrics of the cytokine storm? You will find I made a list of everything. Stomach appetite wanting. So there is a anorexia, kidneys renal failure acute, chest abscess lungs, which is a major cause also of cytokine storm, which could lead to septicemia. General pulse frequent, blood oxygen diminish, perspiration cold, generals collapse. Generals collapse sudden. Generals reaction lack of. These two rubrics are extremely important in addition to the general virulent. So virulent complaint, collapse, and lack of reaction. So this is the three pillars on which everything gets developed, and dysregulated. Then generous vitality decreasing. So a person can go for multi-organ failure, respiration accelerated, delirium fever during, and then you have clinical hypotension. So I made a repertorization of all these rubrics together. Then I added this rubric of the delirium fever during because it's a big rubric in complete repertory. And you have the result of all this. By this result of all these 13 rubrics together, now I have the remedies with their evaluation. And now I'm in a position to give you this particular rubric of the cytokine storm, which a clinician can use in his hospital case. He has not to search for the rubric 10 and 12 and to make a totality. So his valuable time is spent. Not only that, I'm able to give a proper evaluation to this. Let us take, for example, muriatic acid. It is in bold type. Why? If you take muriatic acid together, it is an acid which causes severe collapse state of the system. So much prostration that there is a sliding down in bed. I have 6 cases of muriatic acid where I was able to help the patient overcome the state of the cytokine storm. And if you remember, Roman, we had a case of a pregnancy during where
Yeah.
we were fearing that the lady will go into cytokine storm. And with muriatic acid, we could avert the onset of cytokine storm in this case. And we have total video and everything recorded case of this muriatic acid. So it is possible to go with this. Let us take, for example, carbon group in general, carboanimalis, acetylenediene, creosotum, carbovegetabilis. These are the remedies which must become a part of the cytokine storm. Many acids will become the cytokine storm. So this rubric is actually a rubric that corresponds to many stages, many varying, you see, layers that are available with the cytokine storm. Take for example, a patient of cytokine storm has now gone into a state of septicemia. So you will find you must think of pyrogen in such a situation, carbolicum acidum in such a situation. You must also think of tuberculinum in such a situation. You know, Varietum group in general, especially Varietum album and Varietum viridi, are excellent remedies for averting the cytokine storm and also for the cytokine storm itself. When the cytokines have started releasing and the system is in the collapse state. So it is possible that we could develop the rubric based upon the pathogenetic action, based upon the toxicological proving, based upon the clinical verification of homeopaths for over 250 years of homeopathy on this planet. So this is a very sincere effort to deliver something from the homeopathy with logic, with what has happened within the homeopathy. And if people use it and people experience, they must give the result of what happened to the remedy within this cytokine storm. This will be added strength to the cytokine rubric. I have been using Crotalus horridus, for example, as one of the excellent remedies against the cytokine storm. This could be an aid to allopathic people when the patient is on the deathbed. So now you
Ajit,
see that, yes, yes, Roman.
yeah, just a question here. We see the name of the remedy, mind, delirium, fever, urine
Yeah.
here.
Then
It means
we
that
will,
on
yeah,
basic of
this is
this
all
rubric.
about, I thought that this is the rubric of the cytokines. I will go to the next one. This is the rubric which I prepared.
Okay, great. And now we can see here some remedies we didn't see in a previous slide. And yet, for example, you talk about, yeah, and we see here creosotum and we see here carboanimalis and other remedies as well.
Correct.
My question to you is, did you send this rubric or these rubrics to well-known repertories to complete to Roger Warzenberg, to Radha?
Not yet.
We
Because
have,
you see, I have also to give them the thinking process behind it. This is very important. Why I am including, for example, cuprum aceticum. So there is a logic behind it. There is a toxicology behind it. The aceticum group, is for hypotension also. So now cuprum with a lot of cytokines being released, and then you have the aceticum molecule which you attach to it, the system becomes collapse. So there is a hypotension. Cuprum aceticum is a remedy also for kidney failure with hypotension, like digitalis. So you see the thinking processes are usually these people go into kidney failure, these people go into cardiac failure, and then subsequently the multi-organ failure occurs. So the thinking is that we are combining everything together in preparation of the rubric. It is with pathology, it is with physiology, it is with clinical angle, it is with toxicological data which is available to us. Then the rubric and the related remedies will have some substance to offer. It is not just I pick up something and apply here, because it has no value, you see. Yeah.
and now we have these new rubrics, and when we will receive another cases from another homeopaths, which will proved using this methods, this rubric and these remedies from these rubrics, it will be much more better in and effective in everyday homeopathic practice.
So Roman, this is the reason why I also prepared a lot of rubrics in the management of the COVID-19. I prepared a rubric thrombosis, fibrosis, then about post-COVID complications. I prepared a lot of new rubrics. I also shaped and added in many of the old rubrics, which have been very painstakingly conducted by many of our stalwarts in the past. So this is a updating, this is a something revising the issues about rubric, because our homeopathy is a dynamic science and it has to be upgraded to the level of the applicability issue for a homeopath in the clinic.
And who will be interesting to upgrade himself, we will invite for a special webinar on all these rubrics.
Yeah, and I will prefer a homeopath adding something of his own to the rubric. This is the expectation from the homeopathic community, but they must give us the scientific reasons for the inclusion of the remedy.
And clinical improvement.
Yes, clinical correlation.
Yeah.
Yeah.
Dr. Ajit Kulkarni, thank you very much for your time and for this explanation. You convinced me we need new rubrics.
Yes, correct. Yeah.
Thank you, Ajit.
Yes, Roman. Yes.
Bye-bye.
Best luck.